Happy to answer any questions, and I'm obligated, if I don't know the answer, to say, I don't know. Don't accept some stupid answer from somebody. And a lot of people do from doctors, and they feel obligated to give you an answer. You ask a question, you're paying them. They'll give you the stupidest answer in the world. Don't accept it. Just go, why don't you just tell me you don't know? That's okay. I have respect for someone that says they don't know. Nobody knows everything. Yeah?
I had to go around with a cardiologist that was absolutely insistent on me taking statin and back on aspirin, but couldn't, other than, well, I take it.
Yeah.
That was his only comeback. What motivates them to shill so hard and have no explanation?
They're taught, indoctrinate, when they're in medical school.
Oh, this guy was ancient. He was over 90.
Yeah, I mean, they're taught that. Just you tell the patient what to do. You don't want a discussion. You don't have time. You tell them what to do, and that's it. And it's a different world today. You don't have to put up with that garbage. I want to know there's a number called the NNT, number needed to treat, okay? And what this means is how many do I have to treat to get an effect? With a statin, it's 100. Treat 100 patients, I get one result, NNT 100. Insulin, it's an NNT of 1. I give you insulin, your blood sugar is going to drop. So you want an NNT as low as possible. The NNTs of a statin is 100. Doctor, it's a 99% failure rate. What do you have to say about that? Maybe you'll be the lucky one. That's what they say, Maybe you'll be the lucky one. Are you out of your mind? Just tell me we have nothing better, and of course it stinks, but we have nothing better than this. I could accept that. But the stupidity that I've heard, that's why we need everybody to take them. I said, it's still 99% failure rate. Don't you get it? Multiplying it by a big number, it's still 99% failure. You're not going to get them to change anything except saying, Doc, thanks, I'm not listening to you.
I mean, I was only there for a screening purpose.
Yeah, thank goodness.
This guy was dogged like a scientist.
They all do. I told you my wife did the same damn thing. All I can tell you is if you don't take it, you're going to be worse. Really? Where? Because you were told that by the drug rep? Uh-huh.
Brian, there's a great quote in here from the British Medical Journal. The statin saga forces us to confront the deep flaws in our current system.
Beautiful.
For evaluating medicines and guiding clinical decisions. Deep flaws. It's a whole chapter on statins that Abramson has. So, Bill,
it's horrible.
Yeah.
Who published that aspirin article you're quoting?
Oh, this was, let's see. A1. Yeah, it's on page A1. I didn't. Yeah, it doesn't tell me. October 15th, 2021 is what it was. I'm sure you could just, it had to be a medical writer or something, but I was shocked that it was even published.
I saw that, but I can't remember where.
Oh, they do these things. It hits one paper, it hits piles of papers, because they have services, so they all do the same thing. But yeah, the whole system is flawed. And they also use what's called relative risk instead of absolute risk. So you're under the impression it's 27% effective. You think if there's 100 people, 27 out of the 100, because that's 27%, will see an effect. That's not what it means at all. So we get misled all over the place. They allow them to lie. Legal lying. And the reason for that is because if they didn't, you'd have no drugs because none of them work. That's what I tell my colleagues. Why the hell do you think they do this? They have to. I'm not saying the FDA wants to do it. If they didn't do it, there'd be virtually no drugs because none of them work. Pharmaceutical company's job is not to make drugs that work. It's to make drugs that give the illusion that they work. I didn't come up with that. I read that. It's sad. Yeah.
The vitamin C surprised me. You said it was recycled.
We recycle it, yeah. Now, if you want to do intravenous vitamin C, that's useful for different things, but most people aren't getting that.
I thought it had to be replaced.
No.
Because
No.
you pee it out.
No.
Water soluble.
No, you even get it from meat. No, it's all wrong. It's all wrong. Now, like I said, there's injectable where different people do that. That's a different therapy. I'm talking the oral one, but
So
ineffective. You're wasting your money.
like chewable vitamins.
Nah, waste of money. Waste of money.
Will be alphabetical, then what about vitamin D?
Horrible. Vitamin D is horrible. It's not even a vitamin, it's a hormone. Screws up everything. I read a great paper on this about 5-8 years ago, and I read a pile of stuff, and then sometimes I threw it away. But somebody else just came to me and had the same results on how horrible it is. And it's not a vitamin. It's a hormone. They give you the wrong type. They measure the wrong type. There's storage forms, active forms. The way you get vitamin D is you take these oils, you go out in the sun, and the sun hits the cholesterol in the skin, makes vitamin D. It's all you need. The numbers that they tell are insane. Whenever they have an epidemic, they make up the numbers and everybody is too low. Where did this epidemic come from? Why didn't we have it 30 years ago with nobody having enough vitamin D? Why? I'm asking you. I don't know. My answer is the same thing. Because it's garbage. All they do is make up the next epidemic and gluten-free this, gluten-free that. More insanity. Carbs aren't good, but it's not the gluten in it, it's the darn carb, period. Bread is junk for you. So they all jump on this one stupid thing. Everywhere you go, it's gluten-free this, gluten-free that. I can't even go to Whole Foods and get a normal pizza anymore without this gluten-free garbage that's horrible. Not that I eat many pizzas, but once a month I may get one. And it's insanity. The food people jump on what they think the consumer needs. They don't lead them, and I can see why. It's not their job.
How about celiacs? My daughter-in-law has celiacs.
I would start these oils and get the lining of the digestive system fixed first. Then, if there's still a problem, it's a different issue, but it could very well be this and this alone.
And then how about flaxseed?
You don't want flaxseed by itself. You do not want the seeds either. Don't eat that stuff, especially the hulls. It's not for a human being. Yeah, you don't want it. Keep getting misled.
So why do people take that?
Because they're told that it's good by some idiot. That's why they do everything. Some idiot tells you that doesn't know what the hell he's talking about. And no, flaxseed by itself is more harm than good. You'll screw up your skin. It's got way too much omega-3 in it, and you will have the worst skin in the world. You just take flax oil. Horrible. Yeah, migraines are typically a blood flow issue or a neurologic issue. These oils typically go a long way to helping that. So within a month, I would expect to see the number of migraines go down and the severity go down.
How about a 7-year-old?
Same thing. We've even had people with bad seizures get significant help.
From this oil?
Yes. Yes. We had grand mal seizures patients. Yeah.
So for cooking, what kind of cooking oil?
Good question. For cooking, what do you want? Well, you like saturated fats for cooking or monounsaturated fats. So coconut oil is good. Ghee is good, which is clarified butter. You could saute in olive oil, not too high heat. Avocado oil is excellent. I use that for deep frying, for all the high temp frying. Grapeseed's excellent, but make damn sure organic. You do not. Yes. If you're going to cook, you want organic oils. Little goes a long way. You get a gallon of avocado oil at maybe $40 or $50, but it's going to last you 6 months. And you don't need to worry about it.
Reversing dementia.
It's cardiovascular. You have to get the blood flow in the vein. Dementia, there's at least 40 million to 100 million capillaries in the brain. Capillaries where all the nutrient transfer goes and the oxygen transfer goes. So dementia, Alzheimer's is now known as a cardiovascular disease. If anything can help it, it's this. I want to look at that, but I haven't had the doctors get those kind of patients yet. But I would expect significant improvements within 90 days.
How about some of these shots that we've had, people have gotten?
COVID shots?
Yeah.
What's your specific question?
Oh, I've heard of people that have all sorts of problems with them.
They do, and they have. It's called a side effect.
Yeah, so then are these oils helping for that? Or what do you do with that?
The oils would be more helpful before the shots. After it, I mean, some of these damages are pretty bad. It just depends if it's fixable or not. Some things are just not fixable. I don't know, but the best thing in the world for the future and to ward off any problems is these oils. So if anybody's had the shots, you heard me on the show with the cardiovascular issues, right, from circulation. This is one of the top cardiology journals in America. And what they're saying from the COVID shots, dramatically increases inflammation in the endothelium. The endothelium is the skin. Okay, that's the inner lining of the artery. That's just what I'm talking about. And T-cell infiltration of the cardiac muscle, count for observation of increased thrombosis. Thrombosis is just an occlusion. It's a buildup. It's a blood clot. So they give you these terms, but it's real simple. These oils help that. PGE1 is a blood clot thinner, by the way. That was shown by Dr. Weiss in 1981 in Germany. So everything is major cardiovascular support with these oils in addition to everything else. So to me, if you've had those shots and you're not taking these oils, you're out of your mind. They're the best thing in the world that you'll have any chance of. Here's what the shots do. Number one, they're not a vaccine. It's RNA, period. It does not change your immune system. A normal vaccine is good for 10 years. How the hell do you have a vaccine that's good for 2 or 3 months and you need another one? It's obviously not a vaccine. It's obviously not doing anything to your immune system. What it's doing is it's overloading one thing that your body's looking for. Okay, and that was the original COVID-19. Now, every flu, and it's a type of flu, it's a respiratory cardiovascular flu, is gone in a year. That strain's gone. But what they've done with the RNA stuff is make your body where it's overly ready to go for the next bout of the thing from a year ago. Well, that's not coming anymore. And because they did that, they've tied up the machinery to make new stuff. So now you're sitting with the old stuff. It's like you're real good at defending against a punch, but now I'm going to go in with a kick. I've never defended against a kick. I don't know what the hell to do. That's what your body's going to get with the next infection we get. I'm predicting massive illness over the next 2 years, and I hope, like the Dickens, I'm wrong. But other doctors are saying the same thing as me. You have no idea what's coming. We have altered our immune system like you have no idea. And it's in the DNA of the system. The pharma companies will go, no, it's not in the DNA. What they meant was it's not reproducible, sexually reproducible in an offspring. But it went from the RNA to the DNA. So your own body is spitting out spike proteins in DNA, and they can't argue that. That's a known. So they have altered the DNA in people. That's never been done before. Do they have a good track record of screwing around? No. From hydrogenated oils to you name it, they do it. They butcher everything. So again, if you've been vaccinated and you don't take these oils, my personal opinion is you're out of your mind. This is the biggest saving thing. And by the way, for any lipid envelope virus, Paran omega-6 grabs it by the throat and chokes it. This is how viruses are dealt with in the bloodstream. It's the Paran omega-6. And there's papers on this. I mean, they're highly technical. I don't know if I have one or not. I mean, I had it, but highly technical. Inactivation of lipid envelope viruses and label blood derivatives by unsaturated fatty acids, linoleic, which is Paran omega-6, linolenic, Paran omega-3, gamma-linolenic, first derivative of Paran omega-6, inactivates viruses. Free fatty acid binding pocket in the lock structure of SARS-2 COVID spike protein. This talks about how LA, the Paran omega-6, grabs it, doesn't let it move. So, and by the way, the omega-6 is the vehicle that they use to put the spike protein in to get in your cell. Remember, it's oils. So they're mimicking how it would go in anyway, except they altered it. But the fully functional stuff that we have helps us, and this isn't me saying it, this is the journal. I've never seen anybody pick up on this except me, which is disgusting. Multiple articles, there's at least 3 of them. 2020, 2021, 2022. I've seen nobody reference them from Mercola to anybody else. It's tragic. I mean, the science is there, and there's some real good scientists. Don't get me wrong. There's some real good ones, but it doesn't translate to medical clinical use. That's the problem, because the doctors don't see this. These articles are in technical lipid journals. They're not in Journal of American Medical Association or New England Journal of They're not in the journals they read, and it never makes the jump. It's just a sad state of affairs. So somebody like me never gets into the regular medical journal stuff just because I don't do clinical things. I do theoretical stuff. But it's there. There's real good people. It's all there of what to do. But these oils, biggest thing you could ever take to helping your immune. And what they had, the cytokine storm. You all heard that term? That's what kills you. It's worse than a virus. Anti-inflammatory throttles that back. So we don't need a stronger immune system. You need a properly functioning immune system. Big, big difference. That's that storm where it gets a little and it goes nuts. It's not supposed to happen. So PGE1 throttles that back.
What's your guideline for how much oil you need?
Yeah, on the right formulation, good question. How much do you take? Like 725 milligrams per every 40 pounds of body weight. That's called prophylactically if you're not sick with a disease or disorder. If you are sick with something, you can take 50% more. But it's by body weight. Why body weight? Because it's incorporated into the cell. Remember I told you every one of your 100 trillion cells goes into? It's not like a vitamin, it just hangs around. This is the brick and mortar, so that's why it's by body weight. Good question.
For the capsules.
Capsules are, the ones I recommend are 725 milligrams, so it's one capsule per every 40 pounds body weight. 1 teaspoon of liquid would be good for, probably a 240-pound person because it's about 7 capsules per a teaspoon of liquid if you didn't want to get a capsules. But that's the formulation I recommend.
How do you take yours on a daily basis?
I take capsules. I take. You can either take them in the morning or at night. At night you heal better. So if anybody wants to heal from anything, I recommend taking them at night. If they just want more energy and stuff during the day. Depends what you're trying to do. Overall, it doesn't matter. You're still going to get the same result.
What about half in the morning, half at night?
You could do half in the morning, half at night if you want to. Absolutely. Best empty stomach, 10 minutes. Just let it get in the system, then you can eat whatever you want. If you want to drink coffee or anything, you can do it. But I just like giving it 10 minutes just to get in. It doesn't really matter.
Best on an empty stomach.
Best on empty stomach, 10 minutes. But you can have any liquid you want, water, coffee, I don't care what it is. Just not any hard food because you get some kind of competition with, different systems going on. And it hits the bloodstream fast. I've had doctors going, that's impossible. I said, you give it 15 minutes, you will feel more energy from the oxygen. That's impossible. I said, like hell, it's impossible. Do it. And they take it. I don't know how I was doing it, but you're right. I said, I don't make this stuff up, Yeah.
My husband has, as he's aging, his skin is getting thinner and thinner.
Yeah.
Every time he bumps it, he bleeds.
Yeah. Is he taking fish oil?
No.
No?
He's taking,
Oh,
probably not enough, I suppose.
what are you taking?
The 369,
So you're taking an EFA oil. What do you weigh?
240.
You need to be at least 6 a day. And because of the bad skin, I would go to 8. Yeah, if you have any kind of a problem, you need more because you have to overcompensate to get that. But your skin should get straightened out within 6 months. Next time I'm here, it'll be 6 months. Come. It should be. You could even do 10 if you want for 60 days and see.
He's also had skin cancer 3 times, so it's probably all connected.
Oh, sure it is. Skin in the skin, 10 a day. Or you can go to the liquid, teaspoon and a half.
What can
Yeah,
you mix
this will help you. I won't mix it with anything. It's not going to mix with water. It's not bad. It's not. It doesn't taste too bad. It's an oil. That's why I do the capsules.
Sometimes they're just tired of swallowing them.
Yeah, you can put it in a syringe. I have some patients that you just syringe it, and you can reuse the syringe for a week. So you just figure out how much you use and bang it in there, like my cat.
We use the oils, but I also am curious what would be a good source naturally, like the walnuts or
All the seed oil, the nuts are all preponderance of omega-6. And what you'll get is, oh, walnuts are great because it's the omega-3 in them. That's why the 7-Day Advents get all these great results. Well, it's 5-to-1, 5 times more parent omega-6 than parent omega-3 if you cared to look and see what's in it. So all the nuts are almost every food is more parent omega-6. Some of the vegetables are more like grass. Cows eating it probably is more of the omega-3. Lettuce may be more of the omega-3. But it's very funny, even with a cow, with having all that omega-3, grass-fed cow is still 2-to-1 parent omega-6. So in the cow, it's dumping that 3. It doesn't even want it. But it's designed to live on the grass, which is, I think, 2-to-1, 3-to-6, backwards from what a human needs. But even in its tissue, it's not using it. We don't learn from anything. We really don't. So plant seed oils. Like I said, avocado oil, all you got to do is look at what's in there. It's just hard to get the right ratios with the right stuff in it. And I used to tell people would, do this or do that, but they would never get the results we do. So I stopped doing it. I said, you should be getting these kind of results. You're not getting them. I don't know what the heck you're doing. But there's some kind of a problem, whether they're lying to you on what you're supposed to be getting or you think you're getting and you're not. I don't know. There's all kinds of different strains with this stuff, and you just got to know what you're looking at on the label. I don't think the labels lie. I just think the person didn't know what they were looking at. And you get a little of it wrong, it's not going to work at all. Yeah, I mean, it's highly technical stuff where it can be in a range, but it better be in this range. If it's outside this range, it's not going to work. It's like you can't have more omega-3 than omega-6. You just can't because our body isn't made that way. So you're screwing things up drastically with the wrong substance if you don't know what you're doing. That's why you can't just take flax oil. Good question.
So are there any vitamins we should be taking?
I don't take any vitamins.
Okay, so it's all a waste of money?
To me it is.
Everything you hear?
To me it is. All the B vitamins are in any animal protein. So B12, I mean, if you're a vegetarian, you're going to have some problems. But if you can eat anything you want, I don't waste money on vitamins. Haven't in 20 years. I just don't see the bang for the buck. I mean, could you say it does 2% of something? I don't care about 2%. It's not. It's like a horsepower in a car, you feel 20. 5 more horsepower, it's not worth the money. 10, 12. I don't give a damn. I can't feel it. Get me 20, tell me how much that costs. I may be interested, but it's the same thing with the vitamins. A complete waste of money, and you're going to probably screw yourself up. With vitamin D, it's horrible. It screws up other things because you don't get vitamins taking it the way we're taking it, ingestible. It comes in from the sunlight. So you're bypassing the whole system, and it's the wrong stuff anyway. It's not even close to natural vitamin D. It's all crazy.
There's one a nurse friend of mine told me to start taking since COVID. I can't remember what it's called. It's not a vitamin. It's anybody.
Oh, mineral zinc?
Quercetin? Not quercetin. Yes, that one.
What is it?
No, it's not that one. I don't remember what it is.
Just not big on any of the vitamins doing anything.
Polyflavonoid.
Zinc is okay. It's a mineral. Zinc is okay. It's a mineral. So it's one of the ones I recommend taking. No, I'm very conservative. I don't go anything above like a factor of 8 that anybody would need. And you better make sure on the minerals that they're truly chelated. That means they're bonded to an amino acid. Because remember, I told you the way we get minerals is from an animal that ate the plant. So it goes into the animal and it's bonded in a certain way. That's the way we need it. So it has to be truly chelated is the technical term. Albion Labs is the best in the world, and they do it right. Other people don't do it right. There may be some others that do it right, but most do it wrong. And what happens is they ionize, and you don't know where they're going. So they break apart. Covalent means it stays put. Ionized means it breaks apart. Could be here, could be there. You don't know where it's going. Could bond with the wrong thing. Now you got something that just precipitates out. And it's like calcium. The last stage of plaque is calcification of the plaque. So you got all these poor women taking calcium supplements for their stronger bones, they're told, giving themselves heart attacks. Brilliant.
So what do you do for these bones?
These oils.
Oh,
These oils and protein. These oils are the bone matrix, so they make your bone flexible. You don't want brittle bones. I fall, the last thing I want to do is shatter my bone. I want it flexing in the middle. The outside of it's got calcium. But how do you measure bone density? Just bone density. I don't care where it comes from. Make it hard on the outside. I don't care what the middle is. So take all these minerals. I've increased the bone density. Yeah, but you're going to make my bone shatter. I just said I increased the bone density. That's all I care about. It's a tragic state of affairs every time you turn around. I tell my wife, here's what you believe in the newspaper. 0. 0. I say it's my job to go through this. If it's not your job and you can't think like me, you're not going to be able to do it anyway because you don't know what's right and wrong. You will be misled every step of the way because all they care about is extracting money from your wallet, period. That's it. Just follow the money. Mammograms, by the time it shows up on that kind of an x-ray, if you have cancer, you probably had some semblance of it for 6 or 8 years. Great job, really diagnostic. Get a thermogram, that'll pick it up 6 years earlier, but you need a baseline. They don't care. They've already bought the mammogram stuff, so they're not going to get thermography, even though it's better. It's all about money, period. It's really tragic because you would think it'd be the opposite. It's my health, so that's the one thing it can't be about is money. Anything else, yeah, I'll give you a pass on it. But my health, oh no, that's the most because there's the most money to be made. It's the opposite of what you think. It's the opposite. And it sickens me. Really does. Tough one. You got to know this on your own. Yeah.
I have a question about high calcium scoring. I have scored, like you score 0 to 400.
Yeah, so you got a lot of plaque. You got a lot of. So what number did you get?
Well, my first test, my last one, that they won't do it anymore, was 500.
Yeah, that stinks. Yeah.
Yeah, and so he said I could go to 1,000, my cardiologist. But they say it's just my profile, and there's nothing you can do for it.
These oils will reverse it. We had a patient, Dr. Kagan did a scan, went down 22% in a year. He's never seen it, was in a smoker. He's done 10,000 of them. Top guy. He was the chair of the Nuclear Resource Medicine Committee for the American College of Pathologists. Top guy. Brilliant guy. I met him numerous times in Florida. 22% decrease. Guy stopped taking the oils, came back. He didn't tell him to stop taking them. He just came in a year later, and it went up 100%. He was where he was before. Goes, what the hell did you do? Did you stop taking them? Yeah. Why? I don't know. I just did. So these oils, yeah. Start taking them and let me know. Get another scan in 6 months.
Yeah, they won't even do a scan on me anymore because it's so high.
Go to another place.
Seattle Heart Center.
Go to another place. Get another doctor. They'll do a scan. 6 months, you need another scan. You'll get a reversal. Pay you $100. Next time, I'll be here in 6 months. $100 says you will get. I've got no doubt you'll get a reversal. I can't tell you how much, but you'll get a reversal. You have to. The science says you have to. Get another doctor. He can order the scan, and you'll get it. It's just this.
Well, and he will do it. He'll gladly do it. But
Who?
the doctor here, the cardiologist.
Oh.
Yeah.
6 months, though. Get on these and take 50% more because you got a problem. So it's 1 per every 40 pounds, so whatever you weigh, 50% extra. 6 months, you will probably get 20, 25%. I'll bet you'll get 20% decrease. I'll bet you'll go down 100 points.
Well, it'd be good to get a scan now and find out.
Well, what were you before?
Well,
You were at the 500?
the first one I was 400. A year later I was 500, and he said,
Have you started taking these oils yet?
no.
Well, then you don't need another one. So you're probably at 550 if you want to say, but you're at least 500.
Oh, he thinks probably I'm way beyond that now.
Oh, I see. So you don't have a baseline. So
So thank you.
This will reverse wherever the heck you are. I can't tell you where you are, but this will absolutely. Do you feel bad anywhere? You have any pain, any lack of oxygen, any lack of energy or anything? You feel okay?
It changes.
Could feel better.
I can feel, just.
Take these oils 6 months, come back to the next one. I'll probably be here in October. I'd be very interested to see how you feel. Yeah, you should feel very better. But yeah, when I saw that, he actually was one of the few doctors that found me. He called me. I said, "You're the first one to call me." He goes, "Yeah, this patient's taking something called oxygen pills because he didn't want to get cancer." And I tracked you down from that. Nobody else has. Most don't care. They just don't care when they see a phenomenal result, but he did.
So do you stay on the same heart medications? Like
What are you on?
metoprolol and diazepam? And he has me on a very slight simvastatin.
You can stay on them. You can stay on them.
They're pretty low dosage.
You can stay on them. Yeah, this works with anything. So I really don't care what drugs you're on. I mean, there are always negative effects of the drugs, but you can stay on them and just add this, but 50% extra. And it should dissolve it over time. And it's very safe dissolving. It doesn't just flake off or anything. Yeah, this was known in 1981. They did nothing with it. PGE1 dissolves occlusions. So does Paran Omega-3 and Paran Omega-6. They dissolve them too. So you will get a result.
So our question is, we've never heard you before.
Mm-hmm.
On the radio.
Mm-hmm.
So we're kind of lost here.
Get PO Solution book. It's written for you. You can get up to the science on this. There's too much to go over. It's trying to get a drink like a fire hose. What?
Is there a place that we can call and visit with someone?
Well, Healthy for Life has everything here, but you need to read a book. It's a lot of science. I got to keep telling you, you need to make this information your own. It's the best 4 or 6 hours. It's very readable. Spent a lot of time making it readable. Don't think it's like a medical textbook. It's not.
It has a great index.
The science is there. The index is superb. We spent a lot of money with indexers. It's just a great book. Or you can get the 24-hour diet one. It's got a pile of science too. Whatever one you want, but get one of them.
What did she say she had? I didn't catch that.
Plaque buildup.
Okay.
Yeah, it's a high plaque volume.
Brian, you talk about bad water. What's the best way to get good water?
I like RODI for question is water, distilled water, it's probably the best. There's nothing in it. But you do reverse osmosis, deionization, that's what I have at home. And that's, 99.9% nothing's in it either. But that's using special filters. It doesn't boil. It goes through very tight filters. But you got to replace them twice a year. But one of the two, the water in Houston's horrible. Absolutely horrible. Those poor people are drinking it. I wouldn't touch it. You think? Yeah. It's worse. Wow. I wouldn't touch it with a 10-foot pole. Yeah, Houston's is bad. Yeah. Any other questions? 7:15, 20.
Back on the vitamin D.
Okay, vitamin D.
How much exposure to the sun does a person need?
15 minutes a day, not much. Short sleeve shirt, 15 minutes. If you're taking these oils, if you got the oils, because your skin has to have the right structure. Question is, how much sun does a person need for vitamin D? If you got the oils in your skin, it'll work. If you're deficient in the oils, you're not going to produce it.
It doesn't
I
matter
could
how far you
care
are
less.
from the equator?
You're still getting vitamin D with in the winter. What? Everybody in a northern climate is vitamin D deficient now. How come they weren't 40 years ago? Well, we weren't measuring it then.
Sunscreen is the problem.
Sunscreen's horrible. You get the right oils, you don't need it. You don't burn the way you used to. Had numerous people tell me that, professional bike riders, all kinds of stuff. The sun is good, not bad. Yeah. Colloidal minerals, not big on. They're not covalently bonded. I wouldn't touch them. You don't know where they're going. You need truly chelated minerals. That's the form that we use. Anything else, don't touch with a 10-foot pole. Good question. Appreciate you all coming today. One last one.
I've got arthritis really bad. I've had 4 operations, and they tell me I have the worst spine they've ever seen.
Wow. Okay, now that's a nerve issue, but this should still help with the PGE1. Within a month, I think you should get some 20% at least less pain.
Yeah, the pain's been a lot better. I take the oil.
Good. Okay.
I take like
So it's working.
9 of them a day.
Okay.
Is that enough? I mean,
Yeah, I think so. You're not that big.
Yeah.
But you're getting pain reduction.
Yeah.
Good.
Definitely am getting.
Okay, there you go. The anti-inflammatory. That's the proof. That's the proof. Good. Thanks again. Yeah? Question?
Are the oils anti-inflammatory?
Oh, yeah, because they have the right formulation that gives PGE1 that compensates for the impaired delta 6ing. So the oils compensate for that pathway and are definitely anti-inflammatory. Yeah.
Should we take
Yeah.
turmeric?
Very safely.
How about turmeric?
You can take turmeric. Question is turmeric. I've heard it works. I don't do it myself, but I've had people take it. There's other stuff that does things. I don't know what the pathway is, but I think turmeric isn't going to hurt you. Should be fine.
We sure appreciate it. I just want you
Yeah, my pleasure. Thanks for coming.
Who makes these oils? What company makes the oil?
They're right here. They're made to our specifications. We use companies have to be certified to blend these oils, and they make them to our specifications. So we don't make them ourselves, but we have companies that do it. And Brian here can tell you any details if you're interested in who does them, how they're done, but it's pharmaceutical grade. You know, there's no screwing around with this. It's stuff I've used 25 years myself.
You gave a snippet of a personal journey this morning on the radio.
Yeah, my aorta thing in the morning. Mm-hmm.
I missed part of that. Can you do a 2-minute?
Yeah, basically, real fast with me, congenital aortic valve thing. There's 3 flaps on it, 2 are fused together. Only reason I picked it up was from a little heart murmur. Said, you ought to get an ultrasound on this thing. So I get it, and 2 minutes later, doctor's on the phone, so I'm going, this isn't good. So she goes, I got 2 cardiology appointments for you. You got a problem here. It's 8.4 centimeters. It's supposed to be 3. Your aorta is huge. Your valve is screwed up. It's probably congenital because you don't get this. Especially with me taking the oils, there's no way on earth this had ever happened. So it's congenital, and it just picked up now. So the anti-inflammatory just let me go till now. And it wasn't even that bad. It was very minor. So I get the surgery done, and the surgeon goes, it wasn't 8 point whatever, it was 9.2, which is enormous. You should be in agony because it's very painful. It's supposed to be 3 centimeters like this. The damn thing is like this. A heart is way better than the heart, bigger than the heart. I looked at a picture of it, and you can barely see the heart. The thing is so big. But it didn't blow up. You typically die from this. 30% of the people die. It dissects and you die. Mine did dissect, but it healed itself. So the oils are just incredible. So 2 of them said the same thing. We've never seen anybody this big that's not in agony and has no energy. You should almost be bedridden. I said, it's symptomatic. There's absolutely nothing. We just don't understand it. So then when he did the surgery, I saw him the next day or whenever I was done. And he goes, the pathology of that tissue was commensurate with a 5 centimeter, not a 9. I said, I told you I'm taking the world's biggest anti-inflammatory. And I was on no pain meds, anything. I just said, I'm just taking this. I don't want any opioids. Because it's very painful. They, bust open your chest. It's open heart surgery. And your chest is ripped open for 4 hours. So it does hurt a little bit. And then you're on a heart-lung machine. So I said, scale of 1 to 10, how complicated is the surgery? He looks at me like I'm a jackass. It's a 10, because you can die, because you can die. It's not like you're getting an ulcer on your foot done, where who cares? I said, okay. I take these things real nonchalantly. I'm kind of busy this week, and we shove it off a couple weeks, and yeah, we actually did. And then he said, there's really no big rush in this. You would have had a couple more years. I said, I keep telling you what I'm taking. So that's the personal proof this stuff works. So all he does, probably 200 of these a year. He's he's the top guy in Houston, not one, the. He's probably one of the top guys in the country. He's probably done 10,000 of these. That's all he does. He's never seen a case like me, never seen a case heal like me. 4.5 months completely done. It's typically 12 months. 4.5 months, nothing. Did you have the heart done? Aortic valve?
Yep. I have a cow valve. They wrecked my electrical system. They gave me a pacemaker.
Wow.
Before they finished their surgery, they cooled my body down to 66.
Right.
Took out
Same deal.
my
Same deal.
aorta,
Same.
replaced it with Dacron sleeve.
Yeah, same deal.
Had no pain
No
after.
pain.
Now, were you taking these oils or no?
For probably 4 years before. And
2 for 2.
They were shocked with how clean all his veins and arteries were when they did those pre-tests.
I was out working 4 weeks later.
Surveying up and down.
Can you write this up and send it to me so now I have 2 saying the same thing? Because if you have 1, it's just anecdotal. You know, a doctor doesn't care. But if you have 2, you'll give him a couple bottles of oils, won't you, for the time? No, this is the toughest surgery for the heart. Aortic valve replacement is a bitch. They got to freeze you down. They got a heart-lung machine you. This is a tough one outside of a thoracic cancer deal.
Well, first of all, he had a bacteria.
Infection on top of it?
Bacterial infection before I went in.
Before he went in, it went to his heart valve. And then he was in the hospital for 4 days, and they put a
4 days.
catheter or whatever, not a catheter.
PICC line.
Yeah, PICC line. For a whole month, he had to go before
Every day I
work.
went in for antibiotics.
And you still healed like this.
And then
Well,
he had the surgery.
then a month later I had the surgery, but before I had the surgery I went rock climbing with my son.
Wow. Feel perfect now?
I feel older. I'm 5 years older, 6 years older.
Well,
Don't write that.
yeah, but you don't look it, I'll tell you that. You don't look it. Excellent. Yeah, no, I'd appreciate that. Like I say, if you get 2 of the same story, doctors look at it like, okay, if you get 3, it's even better, but 1, you're lucky. Yeah, but if it's a tough one, this doesn't happen. Out of 1,000 patients, I'm the best one, just luck. But yeah, I'd appreciate that because this is a big surgery, big one, and there's typically problems if there can be problems. Like I say, you talk 4 or 5 hours of this, it's a big deal. Thanks.
How much of it is attitude?
Nothing. Doesn't matter at all. I had no attitude. I was busy. Just you're taking my time. I wish I didn't even have to have it done then. But I was, yeah. But
you were so sure it would come out. I mean,
oh. She's saying positive thinking. Minor. I throw you in a garage with the car running on the exhaust. Close the door. You're dead. You can think whatever the heck you want. You're dead. Now I will say one thing.
Positive, I'm dead.
Yeah. In fairness, if you have a negative attitude, you are burning up oxygen. So you want oxygen. So in fairness, if you're negative all the time, you are constricting, you are burning up oxygen stupidly. So I will give you, but it's not to the level where you're going to wish away cancer, wish away a heart attack, wish away anything. This is all physiologic. That's what I tell people. I specialize in the physiologic, not the psychologic or the mental part. It does something, but way the hell less than you think. You're just not that strong. Very good. It's a good question. Will help cataracts? It should, but I don't know. I guarantee if you have cataract surgery, the surgery will be way better. Faster. All surgeries, you heal better because the tissue is optimized. So any surgery, you take this 2 weeks before, at least, if not, years before, your surgery will be significantly better outcome. And we've had surgeons do this with hundreds of patients to verify it. I'm not making this up at all.
Will these oils heal a prostate?
What do you mean when you say heal? Don't know the cause of it, so I can't say if all I could say is if the tissue is inflamed and it's capable of undergoing reduced inflammation, it should get better. How much, I can't tell you. I don't know what else is going on. Now, the liquid herbal for that specific problem, the two together are phenomenal. I would be shocked if those two together don't do it within 90 days. Unless you have some crazy genetic thing or something that I just don't know that's impeding things regardless. You know, what we do is epigenetic, so it optimizes all the tissue. But if you have something going backwards, I just don't know. It'll still get better, but it won't get as well as if someone didn't have that impediment.
I have a question about the capsules that you put your ingredients in. I'm concerned about the gluten-free because I've all of a sudden just...
Capsules, are they gluten-free? Yeah.
Okay, well, I'm just worried because I do have...
There's no gluten in it.
I do have that problem. I've never had that problem before.
I can hear your
It's just
question.
developed
Gluten, is there gluten in the capsules? No.
because I'm concerned. I just now
No.
started having that problem. So what do you...
Wonder why the heck that happened.
I don't know.
Something changed. Start taking these oils, see if it goes away. It may.
I've been taking for...
Oh, really? So it hasn't gone away? I have no idea. It's nothing I follow. You know, the gluten thing, I just don't follow that. It's something
It took me a really long time.
I have no idea.
It took me a really long time before I even figured out it was gluten because, you know, I went off of everything.
So you low carb?
Yes.
Okay, good.
I've been that way for years.
Good. Carbs make you fat, period. Non-essential, you don't need them. Every ounce of carbohydrate, by the way, you need 3 ounces of water. So the more carbs you eat, you're walking around bloated all the time. Eat a bagel and you'll eat 2/3 of a cup of water. Watch it the next time. You don't believe me.
Now, since you've got access to the information, access to the project, or the products, what is your daily routine?
As far as what?
Well, as to what do you take in this?
Supplements, take the same. I take 2 of the minerals, take a slug of the herbal, and I take the capsules, you know, 4 a day. Now, if I'm real tired or something at the end that I need to get a couple hours extra work at, you know, 10 or 11, you could take 2 capsules and you get that oxygen. It's not like coffee where you're hyper or anything. It's just you're not tired. So we have surgeons doing this too, and they go, I can do another surgery case now. And it's yeah. I mean, they're good.
Well, I'm 87, you know.
They look pretty damn good.
This ain't my first
87. You told me.
But the thing of it is this.
You look damn good. You look damn good. 87.
They say that at the funeral home too, but. the thing
Not at this stage.
Here just recently, I just picked up a little dark spot in my eye. I just kept on this stuff, and I increased a little bit. It is going away.
Good.
Yeah,
Don't know what it
thank
is.
you. It is
Good.
going away.
Good.
But my question is this: for 160 pounds and at 87, what would be the maximum that I could take of this oil?
You typically don't need to go above double. If 4 capsules is normal, you could do double. If you start taking more than that, you'll get too much of the omega-3. And then if you smack into something, you get the black and blue marks, the bleeding. That's the omega-3 doing it.
Well, I always take liquid. I mean, you know, I'm not. Well,
It's just a formulation.
Yeah.
You'll get too much of the omega-3
so
parent.
How much in your opinion,
3/4 of a teaspoon.
3/4 of a
Yeah,
teaspoon
you could
is
do
one
every day.
capsule?
No, 3/4 of a teaspoon you could take every day. Yeah, you. Yeah. Yeah, perfect.
3/4 is 3 capsules.
No, it's more.
3/4 is a teaspoon.
Teaspoon 7.
Okay.
Thank you,
Sure.
Brian.
Appreciate you coming. See you in a bit.